I guess we'll kind of just jump right into it. So I guess first question would be the acquisition of Crestwood. What is Huntsville Hospital One hoping to achieve in all of this?
So our health system we're a nonprofit, locally directed health system. The only reason we're here is to help this be a great place to live and help this growing, thriving community get good health care. We're so excited to welcome the staff at Crestwood to our family. We learned shortly before Thanksgiving that Community Health Systems, the former owner of Crestwood, was considering selling the hospital. And we think healthcare is such a personal choice for people. The decisions about people's healthcare should be made by volunteer board members that live here in the community. So we're excited to bring them to the family and welcome them, and keeping healthcare local is what we're all about. So we're excited to share that with the community today.
So you mentioned a big goal is to provide the best health care for this community, especially as it grows. So how do you guys plan on doing that?
So healthcare is such a personal choice, and how lucky are we to live in this growing community right now? And in order to meet the challenges of providing access, recruiting doctors, training and retaining nurses and physicians, building on graduate medical education programs, we need the strength of both organizations working together. Now we have that opportunity with local leadership at Crestwood, local leadership at Huntsville, keeping all those healthcare resources in our community to make sure we can take care of everyone who walks through our door.
And so I guess there's probably, a lot of questions, not just for patients that, are with Crestwood or Huntsville Hospital, but also with the staff, as this transition sort of happens. So I guess, what is a timeline that we can kind of look for any changes that people can expect, and how can you just kind of lay out that process for both staff and patients?
So right now, nothing at Crestwood has changed. The staff are the same, the care teams are the same. If you have an appointment there next week, that's the same. We're keeping it the same. We want people that like the Crestwood experience. The parking's easier. If you like that, it's there for you, and please continue to use that hospital. The opportunity this creates now is their support and resources, instead of being 100 miles away or 1 mile down the road. And if we need to share resources or support one another, we now have the opportunity to do that and make sure all the great health care that's done at Crestwood is reinvested in our community.
Wonderful. And so I guess with this acquisition, Huntsville Hospital now controls 100% of the inpatient acute care in Huntsville. So how can you guarantee residents that this total lack of competition won't lead to price increases, or that's typically seen in other consolidated markets?
So first of all, our health system exists only to serve the community. We're a nonprofit health system. We operate on very slim operating margins. We make about 2 cents on the dollar. Every penny we make gets reinvested into healthcare to meet the growing challenges of providing healthcare for this community. And all those decisions are made by local leaders. We think this is not a lack of choice, it's maintaining choice for people to use healthcare at Crestwood if they want it. And then I'm very proud of the work our health system has done to maintain rural healthcare outside of Madison County. The community's growing so fast, we cannot take care of everybody in Huntsville. We need strong hospitals in Scottsboro, in Fort Payne, in Athens, and Decatur. We're so proud of the work we've done to maintain choice for those people so they can get care close to their home, just like people can at Crestwood.
Wonderful. And so Huntsville, as a metro area, currently ranks in the bottom 3% nationally for RN pay. So since research typically shows that mergers can depress wages further, is there any plan for bringing local nurse pay up at least to the Birmingham median?
So my mom's a nurse. That's probably why I'm in healthcare. She's probably watching me. Hey, Mom. I don't know where that statistics comes from on nursing compensation, but I can say we're committed to compensating our nurses fairly. We recently announced that this summer we're making an over $30 million investment in nursing compensation to make sure nurses in Huntsville, they're some of the hardest working people in the healthcare. They're the heart of what we do, and we're committed to paying them fairly. And I think those people have choices, and we will only be able to retain that nursing workforce if we're competitive with Birmingham and other communities.
And you said you're hoping to do that this summer?
Yeah, so we announced a couple months ago a large pay increase for our nursing staff across the health system, not just in Huntsville, across the Tennessee Valley, to make sure all those nurses get fair compensation. We'll implement that in this July.
July, okay, wonderful. And so with, I guess, this transition period, it can cause a lot of questions, like I mentioned earlier, for staff. And so how do you plan to, I guess, ensure a culture of psychological safety, making sure that the new staff is feeling comfortable during, this transition period?
So we'll get over there and earn their trust. We were there all night, was there last night. We'll be on site making those folks feel welcome. I believe trust is earned. And we will work very, very hard to make sure the staff at Crestwood, we earn their trust. It's a wonderful group of people. They're all dedicated to providing outstanding patient care. If there's one thing all healthcare people have in common, when you're caring for someone, they want to do an exceptional job. And when you have that as a basis, everything seems to work out, and we're so proud to work with Crestwood.
And so I guess, what is your overall, just your main message? I mean, I know I've asked you, quite a few questions, but if you could just, I guess, kind of narrow it down, if you had to speak to somebody right now and reassure them that everything's going to be okay, what would you say?
I'm reassured that our health system's here only to make this a great place for them to provide great health care. We're governed locally by a group of volunteers who are dedicated to making sure when you have an emergency, you get taken care of. The same is true at Crestwood. And if Crestwood was going to be sold to another entity, I would tell anybody in this community, you're better off with local leadership at Crestwood than somebody out of town trying to make your healthcare decisions.
And as we talk about, I guess, location, of course, Crestwood had multiple facilities located throughout, this northern Alabama area. Will people now still continue going to those, or will they kind of like just everything moves over to those Huntsville hospital buildings that are in place right now?
No, everything that's got the freestanding ER in Monrovia is a great example. We're going to learn a lot from what Crestwood has done. They have much more experience with freestanding emergency department than we do. That will stay part of Crestwood Medical Center. People can use it. If they need to be transferred to Crestwood, we'll make that happen. If they need the higher level of care we might provide in Huntsville, we'll make that happen. We have always cooperated with Crestwood on patient care, and that will not change. It's only going to get better.
Wonderful. Is there anything else that you would like people to know that I maybe did not ask you about?
I just know the community has a lot of questions, and we're really glad we can be here and start to answer them. Healthcare is such a personal decision, and we're so committed to keeping local leadership to our healthcare.
Wonderful.
All right.
Jump in, throw a couple?
Yeah, go ahead, please.
So the statistics that show pay in the bottom 3%, I imagine you could argue that a couple of points either way, but it's pretty clear that, and that was regional, that wasn't specific to.
Yeah, I've not seen that statistics. I don't know where that.
Statistics, and it wasn't Huntsville Hospital. It was the Huntsville Hospital community.
Okay.
But essentially, the Huntsville Hospital community is Crestwood and Huntsville Hospital. The numbers are below. Augusta, Georgia was cited in the report, but other smaller communities across the southeast. Can you think of anything that would explain what leads to, just as a whole, in healthcare, salaries being below what would be the regional norm, below Birmingham, for instance? And do you think it hampers in any way the ability to attract the highest level of talent to this community?
So I think we've got amazing nurses. I haven't seen the report you're citing. I think we've got an amazing nursing staff, and I can't tell you how proud we are of them. We hire hundreds and hundreds of nurses every day. We have over 5,000 nurses that work for us, and I would put the care they deliver up against anybody in Birmingham or Nashville. We're making a major investment now in nursing compensation. We've always been competitive, and we're going to stay there. And we're making a $30 million investment in nursing. It takes some planning and some thought to do that, but we're committed to paying people, and not just nursing. We have disciplines I have electricians and housekeeping, environmental services, people that cook the food. We're committed to making it a great place to work for everybody, making sure people are fairly compensated. I think we have a track record of training people with the local schools. We provide free education for thousands of people a year so they can start a healthcare career. We pay for their education, and they come to work for us, and we pay for them to retrain. We would not be successful with all that luck if the statistics in that report were accurate.
Nursing is one area that's been hard across the country to fill jobs in to some extent, but I don't think it's exclusive to nursing. How's the staffing level right now? Percentage-wise, how close are you to where you want to be?
We're always hiring. We've got lots of openings, but we're in a really good place. All the services we want to provide, we don't have any departments that are not open because we don't have staff for them. So we're always recruiting. It's first of all, how lucky are we to be in Huntsville right now with all the growth? So it's a challenge to keep up with that growth, but we're successfully recruiting. We're blessed to have great secondary education institutions in Huntsville, Calhoun, Drake, UAH, A&M, wonderful training facilities that we work with all of them to train staff and give people a good career option.
Doctors who may be exclusively, or I'm not sure, sometimes I know there's a crossover,
Yeah.
but primarily at Crestwood, will they be available to do more procedures, see more patients at Huntsville hospital facilities and vice versa now?
So the medical staffs didn't change. If you're a Crestwood, you have to have privileges to work at one hospital. Some work at both, and they will continue to do so. If a physician works only at Crestwood, they can continue doing that. If they want to work at Huntsville, they could apply for privileges just like they did before. Nothing as far as our medical staffs has changed.
Last question.
Yeah.
With the expansion that's taking place right now on the Huntsville Hospital campus, can you update us on that, and does this have any impact on that whatsoever?
Yeah, I'm glad you asked that question. The Madison Street Tower expansion is on schedule. It's a $150 million investment to bring 100 new critical care beds to the community. That doesn't change. We're committed to building the 2 freestanding emergency departments that we'd announced, one in North Huntsville, one in Hampton Cove. We'll follow that with continuing with the freestanding emergency department that Crestwood had announced in Madison, so we'll have that on deck. And we're also working on a design and expansion for our Women's and Children's Hospital, and that's just Madison County. I could take you outside of Madison County and tell you about hundreds of other investments we're making to make sure people can still have access to care. It's great to be in a growing community. They're kind of good problems, if you will, but yeah, it's some work to keep up, and we're committed to doing it.
So kind of have similar, questions. Some may be a little bit different, but I guess what were the primary drivers, in all of this for, I guess, Crestwood to sell and let Huntsville Hospital kind of acquire, everything?
Well, that would be a community health system question. The Crestwood entity alone didn't make that decision. Crestwood was a part of the community health system, 80-plus hospital family, and their corporate board and leadership made that decision. So that wasn't done locally.
Gotcha. And so I guess in all of this, this could be a really great opportunity for both Huntsville Hospital and Crestwood. And so what do you think this whole thing will achieve?
I think for the first part, it's going to continue to provide great health care and access more locally than it has in the past. As Mr. Samz said, the money generated through Crestwood Medical Center will now stay all in the Huntsville-Madison County area, used to provide greater health care, more equipment, more services, more people, more opportunity. But the goal of both hospitals has always been patient care. That's the first goal of any great hospital, and I think Huntsville Hospital has proved that, and Crestwood Medical Center has. Our primary goal is to provide great patient care. So a patient who was in Crestwood Hospital bed last night will wake up this morning, and while the community knows it's Huntsville Hospital, the patient will never see a difference.
And that's really wonderful. I guess that's reassuring, for people who were patients at Crestwood. And I guess, what would you say to them? I know some people have some concerns, a lot of questions, but what would be your message to them as it relates to all of this?
To the patients?
Yes, the patients.
Again, they're going to continue to get the great same patient care that they've received in the past from the same team. No nurse changed this morning, no doctor changed this morning, no tech changed this morning, no lab assistant changed this morning. None of that changed. It's all the same. It's just under a different umbrella, and that's the Huntsville Hospital system.
And for the staff, that are working there, I know that we kind of covered it in the other interview, but just how this, I guess, ensuring that there will be some psychological safety here, making sure that staff knows that everything is going to be okay and making them feel comfortable and that they can trust, leadership, right?
Crestwood has an amazing culture. We have not just a team approach, but really a family approach. It's been that way since I've been on the board. And it's one of the things that drew me to the hospital. We are a volunteer board, and every person on our board is a community leader from some aspect, and they're all unpaid. They do it as a volunteer service. So I've been rounding through the hospital since the announcement was made, trying to pick up questions, concerns, fears, whatever is out there. And most of those just involve change. Change is threatening a lot of times, most of the time, I think. And what I try to do is go through and put down rumors or verify them. If they're true, I want the people to know. And if there's a concern, we want to address it early on so it can be identified and worked through. And I've had very few of those. So the proof will be in the performance. And that will happen over the next few weeks, months, years. And I think it's going to work out really well.
You mentioned, change. Of course, people are, fearful of change, and that's completely understandable, but change can also be a good thing as well. One of the questions that, I would automatically think of would be, will there be any changes to benefits that some of the staff may have right now, to pay that the staff is, receiving right now? Will anything like that change at all for them?
I think Mr. Samz can answer that better than I can, but from what my understanding is, nothing, at least in the short term. Where there are pay differences, I think at some point in time those will be equalized. But in terms of benefits, there may be some difference. I'm not aware of what those are. I don't get in that level.
Gotcha. And I guess main message to everyone, of course, as I asked Mr. Samz as well, what would be your main message to them in all of this, if you could just, I guess, summarize it?
From a community standpoint, Crestwood Medical Center is going to remain exactly the way it has been in the past, and it's going to remain that way today. Nothing is going to change from the terms of great patient care or the culture received at Crestwood. It's going to be a welcoming hospital. Anyone who comes there is going to be treated in a wonderful way. None of that is going to change. One of the biggest changes is, instead of getting decisions from an entity 100 miles away, we'll be a mile away from having a decision made. And I think there are going to be a number of resources that will be local, that we can combine, that will help both in Huntsville Hospital and Crestwood. And we'll be a part of another great family.
And I think Mr. Samz touched on this, and I think you might have touched on it a little bit too, about how it's so important to serve this community as it continues to grow. And in the previous interview, we also talked about how healthcare is very personal for people. And so how does this, I guess, from your point of view, this acquisition kind of help Crestwood, but now Huntsville Hospital, try to provide the best healthcare possible for the Huntsville and Madison area?
I chaired the Madison County Commission for a long time, and we recruited a lot of industry and helped this community grow for over these past 35, 40 years. And on those recruiting trips, the first question always asked is, tell me about your education system. And we could really brag on our education system. The second question always asked is, tell me about your healthcare system. So from that standpoint, we can now say we are all, healthcare is provided under one umbrella to prospects coming into this community, and we can prove through history that it's going to be great healthcare. So from that standpoint, I think it's going to enhance the ability to attract more people to the community, and again, provide great healthcare to all of them.
Wonderful. You want to jump in?
Quick one or two.
Yeah.
Who approached whom on the acquisition?
I don't know.
Do you,
That doesn't get down to our board level.
got it. Did the process play out on a timeline that you all expected, or is this sooner than, anything was anticipated?
Again, I don't know what the timeline was from the start to, I was notified on a Tuesday at 10:30 and immediately went over to the hospital and started meeting with the local people here, not the community health system, but our local team. And immediately started going through the hospital once I found out it was going to happen. So from the timing of when it started, I know it was, I believe, prior to Thanksgiving of last year. And to the conclusion, I don't know when the final decision was made.
I know Jeff touched on, I think you did also a little bit, outlying areas. There's been a lot of change here also around the country, especially in rural communities with healthcare. Hospitals that are not profitable, not able to stay open as inpatient facilities. Do you see a shift in how maybe the outlying communities that are part now of the Huntsville Hospital Health Systems Network approach healthcare? I know there's been some closures, but also some openings that have been announced of maybe not inpatient facilities, but advanced level urgent care or walk-in facilities with services that might not be available if you know, the inpatient hospital closes, nothing takes its place.
I think providing health care right now from a layperson's standpoint is probably the most challenging part of this country. You're exactly right. A number of hospitals are closing throughout our state, particularly over the last couple of years. I think what Huntsville Hospital has done through the way they operate their programs have been able to not only prop up a lot of these hospitals, but to maybe keep them from folding. And I think that's going to continue. With the resources that Huntsville Hospital has, and now probably with this acquisition, I think it's going to be even better to help some of these outlying hospitals come to the point of at least breaking even and continuing to provide health care without closing their doors.
Last question. The issue of transparency has been brought up. What would you like to see to assure the public that it is a transparent process? There's been said that the benefits, the economic benefits, will come back to the community in some form. How do you communicate that to the public?
Well, first of all, I'm not sure. If you ask 10 people on the street what is transparency, you get 10 different answers. And I'm not sure where that even goes. I think it's a great buzzword, but to me, the transparent part of this process is going to be patient care. That's the reason for this acquisition and putting the two hospitals together. And to me, the most transparent part of this is going to be, is great patient care going to be provided? Is Crestwood Medical Center going to continue to have the same culture it is, that people have a choice to go to Huntsville, Maine or Crestwood? None of that's going to change. That's about as transparent as I know.